Hey, I'm John Wilkins, your core coach. And today I have a very special guest with me. He is a physical therapist, and we've been in contact for some time now. He has his own practice, and it's pretty awesome. What we touched on. We've been doing the finisher bar, and he has one in his practice, and it's going to be awesome. So stay tuned, YouTube, and listen to what we have to say. Take something from us. We're trying to bridge the gap between physical therapy and training on your own. Let's tell them who you are.
I'm Dan Wallenstein. I'm a physical therapist. I'm an athletic trainer. I have a master's degree in exercise physiology. I have experience working as a firefighter, and I was in the Marine Corps. And right now I specialize in orthopedic outpatient physical therapy. So backs, knees, hips, shoulders, necks, getting people back to their sport and keeping them doing what they love.
Question for you. Are you allowed to say the name of your practice and all that and where
Yeah.
it is?
Yeah. My office is Professional Physical Therapy. I'm in Sparta, New Jersey, but we have offices all over New York, New Jersey. We're even up as far as Connecticut and Massachusetts.
Awesome. So, how did we meet?
I think I was kind of driving around, going to local gyms, finding strength and conditioning coaches and people whose kind of values and philosophies align with mine, so we can connect and get people, the help that they need.
Yeah. So I think I came here, and you actually just kind of walked in.
Yeah, I
That's
basically just
pretty
showed
awesome.
up.
Yeah, I like it. I love it. I'm always looking to learn more. I think learning more wisdom and all that stuff is like it's valuable. It's so valuable.
Yeah.
I've along the way been working with physical therapists for probably 25 years. I've been in business for 32 years. The first 7 years, I just thought I just knew everything and I'd have to go to anybody. Until some people came in and they say, hey, I can't do legs today, I hurt my knee. Or I can't do anything over my head, I hurt my shoulder. So once those people started coming in and saying those things like that, it kind of intrigued me. Like, if I don't figure something out, that's a person I am not going to be training because I won't know how to train them.
Yeah. I think I didn't make this up. I stole it from somebody much smarter than me, but like physical therapy and rehab is training in the presence of pain and injury. And so if you're doing it right, one isn't going to stop when the other has to start.
Right.
The idea is you want to be able to train and also rehab and work around and work through injuries, because the only safe position on the field is left bench.
Right. Absolutely. That's good. and good. I never kind of heard it like that before, I know you said it to me one other time, but just to hear it again that second time, that was like, the light bulb keeps going off, And I always pride myself on, going to find the answers, One of the things that I found that I liked about you is you're calm. You know what I mean? There's a lot of people out there that, you might have to say something to me 3 or 4 times, and you don't mind doing it, which is nice, And then I take it and I, put my little spin on it, and then make it for, somebody that needs help, in my area and my specialty. My specialty is inner core strength. I'm trying to work on things that nobody else is working on. I'm taking that physical therapy to that in between physical therapy to that trainer where we're just doing superficial hypertrophy exercises. So I wanted to be that middleman, because I find if we go from here to here, it's like a car, right? Every car has a chassis. And it just depends on how strong that chassis is for everything to fit on it, like your motor, your frame, your big tires, and all that stuff.
Oh, yeah.
And I always find like everybody wants to put a big Ram pickup truck body on a Honda Civic. And that's when we start getting into more extensive injuries and even just like non-flexibility and things like that. So I pride myself in learning from you guys and going out there and doing that in between stuff, so they don't end back to you, because of lifting,
Yeah.
And at the same time, we still got our mandatory lifts for all of our different sports that they actually have to do those lifts too, you know? So we have a trainer here that does those lifts. I do the middle part. And that middle part is interesting because I start kids at like 7 years old. I've had 7-year-olds on this bar, and I've had 82-year-olds on this bar. And everybody was like, oh, you got to pick an area. And I thought to myself, it's kind of hard to pick an area because every single person has a core.
Yeah.
And every single person needs to strengthen up their inner core.
Yep.
And that's where I fit in,
Yeah.
you know?
Yeah. It's like if you look at the link, any type of sport, any type of activity, you're always transmitting force through your core.
Right.
So you have to, if you're going to squat, your trunk is the lever. If you're going to hit a baseball, your trunk is delivering that power from the legs. If you're going to kick a soccer ball, your core has to be stable to transmit force from one leg to the other, because it's part of everyday life. Like we're going to bend, we're going to squat, we're going to push, we're going to pull, and that force has to transmit through our spine. And we have to be strong enough to be stable and to produce power.
Right, which brings me to a point, the plank. Ancient martial arts and ancient yoga have implemented that plank in, right? So most of my exercises are done off of that plank, and then because they're athletic, you now have to do a mobility plank. So we do a lot of mobility planks and stuff like that. And then we move out to, you know, things where we do like transverse and, you know, twisting, and we become a little bit more sports oriented and the position in the sport. But initially we are trying to build that core, that foundation, right? So when we build that core up, there's 5 muscles that I think about. One is the transverse abdominis. The other is the diaphragm. When people don't realize the diaphragm, they just think it involves breathing. But it's the respiratory pressure, that cylinder around that spine. So when you do something, it does not collapse, right? And then we have the multifidus muscles, the pelvic floor muscles, which are the ones where kind of hold your organs in place, or they'll just keep moving around. And then we have the internal obliques. So that plank focuses on that. And that's my primary, and I've traveled everywhere. And I find maybe 2 people that I've been, thousands of people. Only 2 people told me what those inner core muscles are.
Yeah, I mean, I think it's very easy. People want to focus on the six-pack because you can see that, but it's arguably the least important part of your core when it comes to that, like that function, that stability, and that health.
Which brings me to, sometimes I get comments, and I know they don't know what they're talking about, so it doesn't anger me, but I'll have a big guy, I forget who he was, but he looked like he was about 6'3" or 6'4", and he had 4 plates on the squat rack, and he was like, you want to get big and strong, you want to work core, you got to squat this. And then he gets down, he doesn't even go parallel. And then he comes back up and puts the weight away, and it's kind of like pointing at me. And I'm like, first of all, I would take half of that weight off or more, make you do a deep squat, and then once you're done, get in the plank.
Yeah. Some people are display model only.
Yes. Cool. I like that one. So, hey, I'm glad you're on. We're going to go through
happy to be here.
Yeah, we're going to go through 5 questions. And the main part about this question is, and we'll get into a little bit of this too, we want to explain to people, and we might have covered some already in some of these, but we want people to come from injury or injury prevention to what we do in everyday life, which is type 2 training, which is I train for what I'm going to do, which is life related. I can go outside, I can garden without pulling my back out. I can pick up my grocery bags and not just pick them up, because that's repetitions, right? So we're picking them up, putting them back down, that's 10 reps. But we actually have to pick it up and we have to go somewhere with it, you know? And we don't train that way. We train a repetition. We sit on machines, we do 10 reps and we move on to the next one. So we're gonna try to kind of bridge that gap for everybody. We tried to do it like 10 years ago, and I don't think people were ready for it, but I think they're ready now.
Yeah, there's always gonna be that threshold. You're always gonna have what are they called? The early adapters.
Yeah.
Like the first guy to buy an iPhone, the first guy to jump on email. Someone's going to be that first person to do it, and sometimes it takes a long time because people don't recognize when that innovation is there.
Yeah, yeah. And they're afraid of change.
That's true.
Okay, cool. So the first question is understanding the connection. How do you define the relationship between physical therapy and traditional gym workouts? And what are the key similarities and differences in their approach to health and fitness?
I think we touched on it a
We
little
did,
bit.
yeah.
There's in my view, I don't really see there's a solid line. It's more of a continuum, because when someone comes to me, I don't tend to meet people who don't have pain, who don't have problems. So they're going to come to me and they're going to have a very specific issue and a complaint. And it's my job to figure out what is the root cause of that complaint, and to guide them on the way from stepping through the door, not being able to do what gives their life, purpose and joy, to being able to do everything that they want effortlessly and pain-free. And so that what you're going to have is a very specific kind of evaluation and program that's going to find that one kind of that one problem to address it. And someone's gym workouts, they should all work towards someone's general goals.
Right.
But a gym workout, it's going to be more complete. It's going to take care of everything. They're going to work on not just the one specific thing. And then in physical therapy, we're going to find that one problem that's limiting their participation in their life.
Right.
And so I wouldn't say that there's a link. I would say that you got two different ends. You got the end where somebody's got a problem, then you get the end where somebody doesn't have that problem. And the whole goal of physical therapy is to cover that inside area and transition them from needing me to not needing me.
Right, right. And one of the things I found with the really good physical therapists is they let people leave, or their prematurely insurance might run out and stuff like that. They might not be finished. How would you progress them? Like, I've always admired the guy that said, hey, look, these specific exercises that we're working in here, you got to continue doing them.
That's the key. Is my job as a physical therapist is to work myself out of a job. When somebody comes in and we say, this is the plan, this is how long I expect you to be here, and you should be ready to fire me at this point.
Right.
And so when on your first or your second day, you should leave with a series of exercises that are going to be yours to start working on that independence. And then over the course of those weeks, while you're in physical therapy, that list is going to change and grow as a problem gets addressed, and as you get better and stronger and faster, to the point where, like in that last week, you get an updated list, say like, hey, for these are the things that you're going to use to kind of maintain what you built and kind of keep that going on, forever.
Right.
And because my goal is to work myself out of a job.
Yeah.
We know that physical therapy is, it's important, but like people are remarkable and we heal.
Right.
So there's kind of a defined timeline, and my job is to accelerate that healing timeline. And if you say like, oh, you're going to come and see me, once a week for the rest of your life, it's not the best thing, and it's probably not the best use of people's time.
Right, right.
Yeah.
Yeah. I see it, yeah. All right, that was good. So let's go on to question 2, incorporating rehab exercises. I almost touched on it, but then I stopped. For those recovering from injury, how can they safely integrate physical therapy exercises into their gym routines? What tips do you have for balancing rehabilitation and traditional workouts?
So communication is the biggest thing. It's got to be a team approach. Normally, people are going to have a doctor, they can have a physical therapist, and if they have a coach, a trainer, someone who's working with them for the things that that they're trying to get back to, if all 3 people are communicating and on the same page and working towards the same goal, that's what's going to be the best, most important thing. So a lot of times, what I'll have people like, because of federal law and stuff, people basically just have to sign a specific waiver saying like, hey, like you can talk about my injury with my coach, with my trainer, and then I'll say, hey, like have them give me a call, and we're going to talk about like what's the best way to keep people moving forward and doing what they need to while they're recovering.
Right.
So usually there's initially, if someone says like, hey, like I have a knee pain or you have a knee surgery or something, a lot of times, like the knee stuff, if they're going to physical therapy twice a week, you do the primary knee stuff those days, and then you can say, all right, we're going to work around it. We're going to do these other things so we're not affecting that knee healing early on. Then kind of in the middle, as people start to be more independent, doing their exercise, doing the things that they need to, and they don't need supervision, you say, okay, like that stuff you're going to do independently on your own in the gym, or, we set up the program, say, hey, like I say to you, John, Joe's got this problem, like we're 90% there, we're 50% there. These are the things that I think you could work with him on to really carry him forward. And then once they're done, we say, hey, there's no restrictions, there's no limitations. At any point, if these problems comes up, these are kind of that fire extinguisher, put the fire out, move on. If these things happen, you should probably, get in touch with me, get in touch with the doc. Other than that, like,
Yeah, and then actually it becomes preventative if, like when they come back from physical therapy or they've been going to physical therapy with me the whole time, I take those physical therapy exercises and why you did it with no weight, then all of a sudden you did it with 2 pounds, now we're up to 10 pounds.
Yep.
So in that integral part right there, we are actually now building muscle in a movement that fixed the problem in the first place. Not I did that, we completely abandoned it, and then now we're back to the same stuff we were doing before. And then that's how I make up a comprehensive workout. Maybe we start our workout with those exercises and do maybe a mandatory lift because you have to, and then I'll finish with something of the same, more functional, Yeah. Okay, so let's get on to number 3, preventative measures. What preventative measures can individuals take in the gym to avoid injuries that might require physical therapy? Are there specific exercises or strategies you recommend?
So the biggest mistake that most people make when they start, especially if they don't have a coach, is they ramp up the volume and the intensity way too fast. Because that's what gets people in trouble is if their intensity is too high, they're going to have technique breakdown, their tissues aren't going to be able to adapt fast enough. So there's a few simple rules for runners, for cyclists, for swimmers. There's a 10% rule, and it's kind of backed up in a lot of research, is that you can increase the volume for those aerobic activities by about 10% a week, week after week, and you'll continue to build fitness and you'll decrease your risk of injury. And then if you exceed that, you're increasing the likelihood of having that overuse injury, that nagging pain that gets a little bit worse and won't get better because you're just not adapting. So making sure that you're not kind of ramping everything up too fast, too soon is the number one biggest problem. Because people, when they start a program, we don't have a big attention span. We all want that immediate result, that social media 90-second clip of us going from couch to 5K.
Yeah.
But if we don't carry that middle piece where we're building that base, that's when we get in the biggest trouble. And then making sure that you have the bare minimum strength and power to do the activities that you want to do is another big one. So I've seen a whole bunch of injuries from like adult league kickball because you get somebody who hasn't sprinted in 20 years and they kick a ball and they go to take off towards first base.
Pull their hamstring.
Pull their hamstrings right away because you haven't prepared your tissues for it. So you have to build that foundation and make sure that your body is ready to do the things that you're asking it to do.
Right, exactly. Yeah. That's funny. Collaboration between therapists and trainers. How can physical therapists and personal trainers collaborate to create well-rounded fitness programs for clients?
I mean, I think I mentioned it a little bit before, but just that open communication. If you have somebody who has a specific problem, you say like these are the things that these are the things that we need to avoid for a short period of time. These are the things that are mission critical. As long as you're hitting those and you're balancing those, then you're going to do good. And the other thing is like, what does somebody want to do? What do they like to do? Because we can work together and we can get the most absolute scientific perfect program in the world. And if somebody doesn't like it and they never show up for a second time, it doesn't do any good. So, again, that open communication and making sure that it's it's that progressive transition and people are, doing the things that give them meaning and joy. That's what's going to keep people active and keep people interested in moving forward.
Yeah, right. And then the last question, and then we'll talk about this a little bit, okay? Educating gym goers. What common misconceptions do you encounter regarding physical therapy and gym workouts?
I mean, there's a lot. There's a million of them because everybody's got their own ideas, and it's all over social media. And even like,
So social media is like a big killer.
I mean, social media is like there's a lot of really good stuff, and there's a lot of really bad stuff on social media because just because somebody looks great doesn't mean they know what they're talking about.
Right.
A lot of times people have coaches who it's their thing, and if you can find somebody who just picked their parents well, then you're gonna look like a
Yeah,
superstar.
right,
They're
right.
just genetically gifted. And
Yeah.
so there's a ton of misconceptions, but I think again, you can't replace hard work, and you got to find that line of saying I'm doing enough but not too much, because a lot of people, they think more is better, and more isn't necessarily better. Better is better.
Better's better.
And
Yeah.
if you can take away that that social media, that Instagram post or reel that shows somebody what they did, you can't. If you have somebody who's got a 20-year training history and they've been eating one way their whole life and it worked for them, that's not necessarily going to work for you, and you can't expect those results in that short period of time.
Yeah.
So
Yeah. And they don't realize that that's not what got them there.
Yep.
They've already been there, And let's get to this a little bit.
absolutely.
When I take this around, I get athletes on it and they can't do it because they don't prepare for it. They've never prepared for it. But one of the things they want to do is they want to be like an affiliate. Like, ooh, I'll sell your product for you. And I can't do that because you haven't been on it. So to me, I would be lying.
Yeah.
You know what I mean? Like if you actually got on this, along with what we were just talking about, you got on it, you showed the results, you feel it, you've been on it for a few months, and then you want to be a testimonial, you want to, sell it, be an affiliate, that's one thing. But I can't just say, just because this guy has shredded abs and he did it because, again, he can do anything he wants and he would have them anyway, I can't say that, and I find like when people come up to me and they go, what do you think of this exercise? Look at the way she looks, or look at the way he looks. That's actually not how we got there.
Yep.
And it's the betrayal of the mind and the betrayal of what we are as therapists and trainers and stuff like that as to how we got somewhere. It's just like a lie for money, and that's why I have my problems,
Yeah, it's people are trying to sell things. People are trying to make money. Money makes the world go around, and it's people want to latch on to something that they think is gonna give them success. And if they have faith in the product, that's great. But if you don't understand or how to use it, it's hard to sell.
Yeah, yeah. So you came in and we got on this,
Yep.
right? What did you think?
It kicked my butt. It was tough. It was definitely tough. It was really good. It was a very different program than anything I'd been exposed to before.
And you have one for your practice.
I do. Yep. I think I have. You gave me not this one, but one of the other versions. And I've used it a bunch. I've used it a lot. I use it a lot with people who like the tactical industrial athletes, firefighters, military members who have to be in that low plank position, maneuvering with the tool, because it's super effective. And it helps to mimic that functional activity really well.
And one of the things he said to me when we first got on this thing was it would be good because some of your older patients have problems with their wrists.
Yeah.
And to actually put their hands on the floor to get into not that plank position. That was that position where you had them on the hands and knees, and one knee was on the block.
Yeah.
And then tell me a little bit about that.
Yeah. So like I said, I don't tend to meet people who don't have pain or problems, and a lot of times if as we age, unless we're really intentional about it, we tend to stop doing certain things. A lot of people stop playing on the ground. We stop balancing. We stop doing stuff that's kind of like play or sport related as we get older because we don't make the time for it, or things get in the way, or we just have lost interest. And so some of that, people get really stiff, really painful joints over time. We're going to get arthritis, and we're going to lose some of that mobility. So being in that that wrist extended standard push-up, plank, plank on extended arms position is kind of painful for people. And it tends to be a barrier to people participating in an exercise. Because if I ask you to say, hey, John, do this thing, but like, it's like, maybe it's great for your back, maybe it's great for your core, maybe it's great for your knees and your shoulders, but like, it's just killing your wrist, you're not going to do it.
Right.
Or you might humor me and do it, in the office, but then you're never going to do it at home because like, yeah, it doesn't work for me. So,
and nobody feels like fighting through the pain. They came to you to get out of pain.
yeah, like people don't come to me because they enjoy pain.
Yeah.
It's a different job.
Yeah.
But so being able to get people into that position where they're able to challenge themselves and be comfortable and sustain it for long enough, where they're finding the pain of that lactic acid, that muscle burn, as opposed to the joint pain that they just don't like.
Right.
It helps a lot. It's tremendous, because before that I would have to try, like, I'd roll up towels, I'd use like foam rolls and stuff like that, because the exercise specifically with the yoga block, that's for the multifidi. That's like the entry level base. Like, this is like day 2, what we're going to do to start you strengthening that specific muscle. If I can't get you in that position, then it's going to be really difficult to find an effective way to do that.
Right. That's awesome.
Yeah.
I tell you, man, this is, I had Sean Wilkinson on a couple weeks ago, orthopedic surgeon. I decided to switch from just your standard athlete to really getting information out there to people. That's why I asked you to come on. And next week we have a cardiologist talking about when he gets on this thing and he's out of breath, what is it good for? So in order to get that information out there, you gotta start from, I feel, physical therapy, and then work it through training, right? So it's that foundation, like, why am I doing this? What am I supposed to be feeling? What position should I be in? How am I compromised? Am I missing alignment? Am I causing a problem? I may not feel it that day, but 15 years later, it's like, oh, I picked up my thing today and I hurt my back.
Yep.
So that's why we had you on, and great with the answers. I mean, it's just a lot of really good information. I think people need it,
Yeah.
and definitely, if you don't mind, we'll do this a bunch of times,
Absolutely.
We'll come up with some more questions, maybe answer some things that people have comments about, and this is great for YouTube also,
Yeah.
I appreciate everything. Thank you very much.
Pleasure being here.
Yep.
Thanks for having me.
You're welcome.